10 most common diseases during monsoon. Welcome everyone to our channel Wise Nest. Monsoon is the most awaited season, especially after scorching summer. Though it brings freshness in the environment and provides relief from the summer heat, it also brings lot of infections and disease along. The weather is humid most of the time and several bacteria, viruses and germs multiply. It is also a perfect time for the breeding of mosquitoes, inviting viral infections. We have monsoon related videos on our channel such as do's and don'ts during rainy season and skincare during monsoon. Do check them, the links are provided in the description. In this video, we are going to list 10 common diseases that are seen during rainy season. The information shared can help you in this season. So let's get started. The first one, dengue. Dengue is the most common disease caused during monsoon and is spread through mosquito bites of female Aedes mosquitoes. They usually bite during the daytime or before dusk. The symptoms include high fever with body ache, rashes, fatigue, nausea and vomiting, headache, pain behind the eyes, low platelet count. In severe cases, there may be less urination and breathlessness in few patients. There is a risk of drop in a platelet count during dengue, which can be dangerous if not addressed timely. The normal platelet count is more than 1 lakh per microliter. The second one, Chikungunya. Chikungunya is caused by mosquitoes that are born in stagnated or still water. These mosquitoes are found in overhead tanks, coolers, plants, utensils, and water pipes. This disease is caused by the tiger Aedes mosquitoes. The symptoms of chikungunya are acute joint pain, high fever, fatigue, and chills. If not treated timely, certain complications such as inflammation of the retina, heart muscle, liver, kidney, etc. can occur. The third one, malaria. The most common disease of the rainy season is malaria. It is spread by Anopheles mosquitoes. This happens due to problem of water clogging during rainy season, which is a breeding ground for mosquitoes. The symptoms of malaria are high fever with body ache, many a times shivering and body chills, excessive sweating, and severe anemia. It is very important to treat these symptoms, otherwise it can lead to health complications like cerebral malaria, which is one of the cause of death among malaria patients. If malaria is not treated timely, then convulsions, renal failure, jaundice, and respiratory disorders can occur. The fourth one, cholera. Cholera is another very common disease. This disease is caused due to consumption of contaminated food and water. Poor sanitation and hygiene can also cause it. Cholera needs immediate treatment as it can turn dangerous within hours. The symptoms of cholera are profuse watery diarrhea, vomiting, feeling thirsty, muscle cramps, low blood pressure, rapid heart rate, dry mucous membrane, and loss of skin elasticity. The fifth one, typhoid. Typhoid is a highly infectious and a common monsoon-related disease. This disease is usually caused by contaminated food and water. Some symptoms include prolonged high fever, weakness, abdominal pain, constipation, headache, vomiting, and reduced appetite. There may be several complications in typhoid if not treated promptly. The sixth one, viral fever. This is the most common fever throughout the year but is more prominent during monsoon season. It is mostly caused due to viral infection, and the symptoms of viral fever are fever with or without chills, cold and cough, inflammation of the throat, weakness, dizziness, muscle ache, body and joint pain. This fever usually lasts for 4 to 5 days. The seventh one, diarrhea. Diarrhea is the most common complaint during monsoon season. It can be a temporary one or can turn to a potentially life-threatening one. It is caused due to consumption of unhygienic food and water. The symptoms are commonly loose watery stools, abdominal cramps, fever, bloating and nausea, and sometimes blood in the stool. Immediate treatment is necessary to avoid complications. The eighth one, common cold or flu or influenza. Common cold or flu usually occurs due to the change in weather and fluctuation in temperature. One must protect themselves as it can turn into a viral infection and transfer from one person to another. The symptoms of common flu are fever with headache, aching of the muscles, nasal congestion, sore throat, sweating, and dry persistent cough. The ninth one, Leptospirosis. This is an uncommon bacterial infection which is transmitted from animals to humans. If you have any open bruises or cuts, then it should be covered when stepping out to avoid getting this disease or any other infections. This disease usually spreads through open wounds while walking through waterlogged areas. Some symptoms include high fever, headache and muscle aches, abdominal pain, red eyes or rashes, and diarrhea. The 10th one, stomach infections. Stomach infections occur when you consume unhygienic food or liquid products. Gastroenteritis is one common stomach infection that occurs in rainy season. Few symptoms of stomach infections are low-grade fever, nausea, vomiting or both, abdominal cramps and pain, and diarrhea. Drinking boiled water and home-cooked food is advisable during monsoon. Now let's see how to prevent these diseases during the rainy season. In the rainy season, the risk of infection and fever is more common and we have to boost our immune system to fight these infections. You can watch our video about 5 superfoods to boost immunity. Right now, sharing few tips for the rainy season. Eat more nutritious, healthy and home-cooked food and avoid junk food. Stay hydrated and drink boiled and clean water. Make sure your home is well ventilated. Wash hands before eating any food. Maintain personal hygiene. Keep your surroundings clean and remove the breeding grounds for mosquitoes. Use a mosquito repellent, mosquito net and protective clothing. Wear a mask while stepping out to avoid the spread of infectious diseases such as flu and cough. Avoid visiting crowded places to reduce your risk for viral infections. Avoid touching your nose and mouth with your hand without washing them. These were few tips. Enjoy the monsoon with proper care and precaution. If you or any of your family members suffer from the disease mentioned in this video, do not take it lightly. See your doctor immediately for right treatment. If you found our video informative, do like, subscribe, comment and share. See you soon in another video. Till then, do take good care of yourself. Thank you.